I am Dr. Vipul Gupta. I am head of neurointervention and co-chief of a stroke unit at Artemis Hospital in Gurgaon. Artemis Hospital in Gurgaon is one of the very few centers which has a dedicated stroke and neurointervention unit. We are 3 faculties along with 3 other associate doctors team working only in this field, which shows the focus our hospital has on this deadly disorder. Stroke happens when the blood supply to the brain is blocked off for some reason and the brain cells die. It's a very deadly disorder because most of the patients remain disabled for life and many don't survive. It has become the 3rd most common cause of death and disability along with the cardiac disease and cancer. And sadly, in our country, it is increasing with time, particularly in younger population. One of the major change in stroke has been neurointervention. Neurointervention is a field the way in cardiology they go through the leg or arm blood vessel and could do angioplasty, stenting and other treatment. Same thing we can treat brain blood vessels go through arm and leg blood vessel and treat by endovascular minimally invasive technique. By this technique, actually nowadays in acute stroke patients come with paralytic attack, we can actually reverse the stroke if they come early to the hospital, particularly within first few hours. But up to 24 hours also we can do this procedure that we go endovascularly through the leg blood vessel usually, and the blockage caused by a clot in the brain blood vessel, we remove it so that the brain blood flow is restored and the brain function recovers much better if not doing this procedure. So it's a very huge advancement in medical field, and it's very important that patients come to what we call a stroke ready hospital where very quickly they can do this mechanical thrombectomy procedure. Also, some patients have decreased blood flow to the brain because of blockages in the blood vessel, stenosis which develop. Same thing like in heart, it can happen in brain blood vessel, which you call as carotid stenosis. So previously all patients could be treated only by open surgery, but nowadays most patients we treat by endovascular carotid stenting, and even other blood vessels of the brain, any blockage we can treat by stenting procedure. Brain also suffers from hemorrhage. Some hemorrhages because of hypertension, but many hemorrhages are because of swellings in the blood vessel, weakness in the blood vessel known as brain aneurysms. Brain aneurysms are like balloon in the brain blood vessels which keep swelling and burst to cause bleeding. This can happen in any age, usually 40, 50, 60, and particularly women are more sufferers of this, and suddenly without any warning they can have major hemorrhage, and it's a deadly disorder. It is very important in this disease that we close the weak spot, the aneurysm or the balloon in the vessel. Previously again only open surgery could be done, which was much higher risk, but nowadays I'm proud to say that more than 95% of cases we treat by endovascular neurointervention techniques. Sometimes we can place coils which are like metal rings in these balloons. Sometimes we can place some devices within the balloon. Sometimes we can place stents and coils, and there are modern technique known as flow diverters which are like metal pipes to repair very damaged blood vessels also we can treat. So most of the aneurysms nowadays can be treated very safely by endovascular technique, and many of these patients nowadays go back to live their normal life, which is a miracle of modern medicine. Brain also has sometimes disease known as arteriovenous malformation. These are swollen blood vessels within the brain with very high blood flow within them, and they also can cause burst to cause bleeding in the brain. These also we can treat by neurointervention embolization technique. Again, from the leg or arm we take a very thin tube into this bunch of blood vessel, we inject liquid material which becomes solid and closes these abnormal connections of AVMs. AVMs are treated along with neurosurgeons and radiosurgeons because there are many techniques to treat these AVM disorders. So what I wanted to say is that by these modern neurointervention techniques, we have come a long way in treating the most deadly disorder of the brain known as stroke and neurovascular disorders such as aneurysms and AVMs. And Artemis Hospital, we have a dedicated biplane cath lab, one of the most advanced in the country, is one of the highest volume centers in the country, and also we dedicated ICU and our vast experience of aneurysm disease and the teamwork which we have. I am proud to say it is one of the renowned centers in the country for treatment of these disorders. Thank you.